Okay, so let's do this. All right, so welcome to today's meeting again. I'm so excited. I have two guests today, and they are going to be sharing with us very exciting opportunity for those who are in the US and for those who are aspiring to be in the US. It's something that you need to know. Trust me, you don't want to miss this opportunity. You don't want to miss it. This is one of the programs when I say you don't want to miss it, and in my heart, I'm feeling like I'm not saying it enough because this kind of program doesn't come by every day. It's a program that we all have to be in, we all have to gain from, and we all have to, I mean, see how I'm smiling. There's a lot of people that are already gaining from this program. So that's why I'm excited because I'm bringing it to you guys. All right. So please, kindly let your friends know. So today we're going to be discussing an important area of remote job opportunity in the US. And with me here, I have Dr. Oluwole Ajobasile. Ajobasile. Sorry if I murdered your name. I'm so sorry. he's a medical doctor from Nigeria and a clinical documentation improvement practitioner in the US. Okay, he's here with us today, and also I have Olayemi Oduwole. Olayemi Oduwole holds a master's degree in nursing, BSN, and RN, and also she is a clinical documentation improvement practitioner here in the US. All right. She's also one of the director of Novel Training Services LLC, and we also have the Dr. Oluwole is also a director in that company. And I have two directors that are going to be talking to us today. What an amazing event! You don't want to miss this. This is one event that I don't want anybody to miss. Okay, so today, we're going to be talking about the job opportunities for registered nurses, their spouse, registered nurses' spouse. Okay, let me tell you guys one thing. What is motivating me to do this? I'm not paid for it. So I can as well go to a hospital and spend this time and work and get paid. But number one, everything about me is not money. That's number one. Number two, this program has actually helped a lot of spouses of nurses who are here in the US. Because one thing is, I've had lots of conversation with husbands of nurses who are doing well back home. They are doing well back home in their different country, Kenya, Ghana, all those countries where people migrate from. They are doing well. So the question that they ask me that I find it difficult to answer is, what will I be doing when I get to the US? I know most of you have said your husband have asked you that question, right? Because when you said you want to go to the US, your husband, looking at his opportunities, you have that opportunity as a registered nurse, but your husband does not. So your husband is asking, what will I be doing in the US? And most of you have answered, some people will drive Uber, you can work in Walmart, and the husband is picturing himself working in Walmart. I'm not saying those working in Walmart don't make a living, but it's not going to be as at par with what you're making. Okay. So your family will go far, very far, if your husband is making the same amount of money that you're making, not less, or even more than you're making. I know for men, our ego will tell us you need to make more than your wife, right? So when they ask me those questions, I always don't have answers for them. But I'm excited today because I'm beginning to get answers. I'm beginning to get lots and lots of answers to the spouse of registered nurses migrating to the US. This is a brand new opportunity. Okay. So one of the other things that you're going to know about this job opportunity is that it's also available for all for all the foreign medical graduates. Like most medical graduates come to the US, and the thing that they hear from people is that you have to read. You have to read because if you don't read, you will not be able to pass your steps, okay, your USMLE. So most of them just focus on reading. And at that point, they don't make any money. And trust me, the reading is not for 1 month. They read like 6 months, for some time a year. So this is actually a good opportunity because once they are reading, they can also have another laptop where they are working from. Okay, so it's a very good opportunity for them too. It's also lucrative work from home job opportunity. So you do it from home. They don't need to go to any office. They don't need to clock in and clock out and, at any facility. They don't need to join traffic or just, be on the traffic light and blaming someone for being late. You do this from the comfort of your home. And then for those of you who are hoping and praying and wanting to get away from the bedside, this is a brand new opportunity for you. All right. So without wasting much of our time, I am going to introduce our guests. Okay. So today we have with us Dr. Oluwole Ajo Ajobasile. All right. He is here with us today. I would like him to introduce himself. I might have murdered your name, but I'm very sorry about that. Please kindly introduce yourself for us, please.
Hello, everyone. Mr. Distance, thank you so much for pronouncing my name. I think you did a good job. So you did not murder my name. And I'm actually impressed with the way you pronounced it. Let me start by saying it's an honor to actually be here because I'm seeing people from all over the world. I mean, there was somebody from Brazil, there was someone from, was it London?
Yep.
And of course, we have a lot of our folks from Nigeria as well. So it feels like we're home, and this is a good platform for all of us to come together. And like Decency mentioned, my name is Dr. Wale Ajubashile, and I'm a foreign medical graduate from Nigeria, and I've been working in clinical documentation for many years now. And one of the things that I think I want to start by saying is that if you have spouse that are in the medical field and you're thinking about relocating, I think I can relate to their story. Let me start by talking about that because getting residency in the United States is not just about reading, it's not just about passing the exam. They want to know if you understand the system. And clinical documentation can actually open the doors for that because you're already going to be working with physicians, you're going to be seeing how they're documenting, you're interacting with them, and that puts you at an advantage, especially if you're able to land a job in a center where they have residency. You can use that as a leg up to getting interviews and potentially getting residency there. But enough of that for now. Like I mentioned, my name is Wale Ajubashile, and I don't know if I should be the one to start talking about the opportunity, or should I let the other guests introduce themselves first? Then we can talk
Yeah.
about
Yeah.
opportunity.
I'm sorry. Yeah, sorry about that. I should have done ladies first. My bad. Okay. So,
I'm being a
all right.
gentleman.
So let me come to you, Yemi. Forgive me. I'm learning. If you ask my wife, she will tell you that I'm still learning, right? Okay. So please, Yemi, would like you to just do like a proper introduction of yourself. Then we will go into the program proper. You can unmute yourself, Yemi. I think you're muted. Thank you.
Hello, everyone. Good
Hi.
afternoon, good evening, good morning, wherever you are right now. I think we're all in different time zones. I'm a registered nurse and also a clinical documentation practitioner. I understand where we all are right now because I've been there. I started my career back in Nigeria in 2011, and I have worked in the United Kingdom before coming to the United States. And yeah, I'm happy to be here to talk to everybody.
All right, Yemi, thank you so much for being here. Both of you are directors. I know you're trying to be humble, but both of you are directors in Novel Training Services. So what is the company all about?
Well, it's all about training people in clinical documentation, people that have the license, like registered nurses, foreign medical graduates that are able to practice here in the United States as a clinical documentation practitioner or specialist.
Wow.
Yeah.
Wow, awesome. So we're going to talk facts today. So I prepared a question. I'm sorry, you guys may not know about this question, but I prepared a question for you guys. So after asking you guys the question, I'll give you the opportunity. I'll give the opportunity to my audience to ask you questions too. All right. So, but the question is just for us to be able to understand, because I saw that you guys are running a program, is a clinical documentation improvement practitioner training program. And this program, you said, is starting on the 26th of November. And then the fee was for $500 at a discounted rate. And then you also said the benefits are alternative to bedside nursing, work from home, suitable for foreign medical graduates while waiting for residency, and alternative source of income. So we're going to be covering all those things that you advertised on your flyer. We'll be covering it in our questions, just to get to know what this clinical documentation improvement practitioner is, because I believe that this is what you guys are practicing right now, and you guys will be able to give us more insights into understanding what the program is all about. Okay, so first of all, I will say this first question will go to, I would like to do ladies first now. So I would like to ask Yemi. Yemi, can you briefly explain what this clinical documentation improvement practitioner is and why it's important in healthcare, please?
So see, the clinical documentation is all about documentation just from the word, just from the word clinical documentation. It's all about documentation of physician on a patient in the hospital here in the United States. So what we do as a clinical documentation specialist is that we review documents to make sure that it is complete, it is accurate, it depicts the severity of the patient's illness. Now, this has different benefits, and one of the benefits is that it improves the quality of care of that patient. It also helps to increase quality rating of the hospital, as ensure accurate reimbursement. So that is just, I don't want to go into it too much, but that is just a summary of what clinical documentation is all about.
Sounds good. Thank you so much. So I just want to look at it in a layman's, in layman's term. So like you review the documents that of hospitals, right? So when a patient is discharged, you review the chart just to make sure if everything went well with that patient. Is that correct? Am I correct?
It is while they are actively in the hospital. For
So
instance,
it's ongoing.
Yes.
Sorry to cut you short.
Yes. For instance, sometimes they do discharge patients, but it's not very common. Most times it is when that patient is still on admission. So when the patient comes into the emergency department, we try to give the patient at least 24 hours before we do the review. You are looking for completeness, accuracy, making sure that they are picking the right diagnosis. Let me give you an instance. Maybe a patient comes to the hospital and is being that came in with confusion, and their diagnosis is altered mental status and urinary tract infection. Now, altered mental status is just like, it doesn't really have any quality when it comes to a diagnosis. So you want to be asking the provider to further specify what it is. And with that alone, we are probably able to capture something like metabolic encephalopathy, which is a strong diagnosis. And with provider having that kind of strong diagnosis, they are making sure that the patient gets the treatment that kind of diagnosis requires. So it helps to increase the quality of the care that they give to that patient, because the diagnosis is captured accurately, and it also increases the quality of the quality that hospital, because it shows that they take care of severe patients. It's just like the more severe patient the hospital can take care of, the more respect they give to that patient, as well as it ensures that instead of being paid for altered mental status, they are paid for metabolic encephalopathy, which is a stronger diagnosis. So it ensures accurate reimbursement. And I hope that makes sense.
Okay. Well, we have all those buzzwords, encephalopathy and all that. I'm a businessman now. I've left nursing. So I have forgotten a lot about those words. But what I understand is that if somebody comes with malaria and it was documented as fever, okay? So it was documented as fever, and then the hospital is going to get paid for the services of someone that had fever. But if they documented it as malaria, that means the hospital will be paid more. So which means you guys are making money for the hospital, right?
Yes, it's one of the things we do. Yes.
Okay, sounds good. First of all, we had a lot of people that just came in now. I'm very sorry. Some of the link that was dropped in some of our program, in some of our platforms were dropped late. I'm very sorry about that. More people are still joining. Just to let you know, we are still starting. The program just started. We just asked our first question, so you're not late. Someone was saying the meeting has gone far. It hasn't gone far. We are still in the meeting. All that we did was just to introduce the program. And for the benefit of those that just joined us, I'm just going to go a little bit backwards and then I'll show you guys what we shared. So this is the flyer that you guys may have seen in all the platforms where you joined us from. And this is just us, telling you about the program we're going to have today and the guests that we're bringing. Okay. And then we have this training program, which, brought us to where we are now, which is this company that is doing a training for those qualified and those that can pay for it. The training is supposed to help those that are already in the US or planning to come to the US with, being able, either US or Canada, remember, being able to work from home. It is also an alternative for bedside nursing and also suitable for people who are waiting for their medical exams, okay? And it's a source of income. We're going to talk about how rewarding this very particular program is, okay? So we'll get to that, but for the meantime, this is just where we are. Olayemi was able to give us a brief introduction into what the program is all about and why it is important in healthcare. So they save a lot of money for the healthcare system. This CDI program, which is Clinical Documentation Improvement Practitioner, what they do mainly is that they review the chart to make sure that what the patient is being charged for or the services that the hospital provided to the patient is being paid for, not the hospital provides excessive amount of services to the patient and the patient pays for, very minimal, amount of service. Of course, in the US, it's not the patient paying, it is the insurance paying, but just to make sure that insurance actually pays what is required of them to pay. All right. So I'm going to come to you, sir. My next question is, what are the prospects for individuals who complete a clinical documentation improvement course? Are there a lot of job opportunity in this field? Like, is it something I do now and have to stay 1 year, 2 years, I'm still looking for a job? How lucrative is this job?
All right, thank you for the question. I think what my first response will be Google is your friend. If you go to LinkedIn today or you go to Indeed and you put in clinical documentation jobs, you are going to be flooded with opportunities. And the word is flooded. You're going to have more than enough opportunities. And the beauty of it again is the fact that you are not restricted to where you're staying. So you can be staying in Arkansas, for example, and get a job in Maryland. You can stay all over anywhere in the country because most of the opportunities that you find right now in CDI are remote jobs. So which means your location does not restrict you. So, and then the other thing about clinical documentation is that the entry level is very high. Then apart from that, you also have that potential for advancement. Like you can become a CDI manager years down the line in the field. And apart from becoming a CDI manager, there are also bigger roles in revenue cycle that you can move into, which is like a managerial role in the hospital. So CDI opens the job for a lot of things
Wow.
in nursing, in hospital management.
Wow. So there's lots of job. Actually, me, myself, before I came for this program, I've checked them out. CDI has a lot of job opportunities, and those opportunities are just, they are just so rewarding. Like the amount that they pay, if I'm not someone that, is very determined in being in business, I would say I would just quit my business and go and start clinical documentation specialist program, because that's payment that I see on Indeed is quite mind-blowing. You can check it out yourself. I did not add it here because you need to do some work. So you can also go to Indeed and check out clinical documentation improvement practitioner jobs. Okay, when you do that in the USA, you're going to find lots and lots of opportunities. Okay, while we are talking about that, I have another follow-up questions to this, okay? Question 3 is, how can completing a clinical documentation improvement course enhance someone's career in healthcare? Like, for instance, I don't want to leave healthcare. I want to leave bedside, but I don't want to leave healthcare because for some of us, healthcare is all we've known all our life. Okay, so we find it difficult to go to, like, for now, there's an adage that say an old woman cannot learn a new dance at old age. Okay, so it's difficult. So how can completing a clinical documentation improvement course enhance someone's career in healthcare, and what advantages does it provide compared to other health-related courses?
All right, thank you for that question. So the thing with clinical documentation is that you are still bringing all of your clinical skills, all of your bedside skills. Those are what you are going to use to be able to ensure that the way the doctor is representing the clinical condition meets the severity that the patient is actually presenting with. For example, for you to be able to know that this a patient where they documented urinary tract infection as maybe sepsis, you need to have managed sepsis on the floor. You need to understand the diagnostic criteria for sepsis. For example, you're seeing that this patient has UTI. Then in addition, you can see the white count is elevated. The patient is also tachycardic and tachypneic. Patient has a fever. Then there are other markers of inflammation. For example, the procalcitonin is elevated, lactate is elevated. These are skills that you are bringing from managing patients on the floor. So when you are in CDI, your clinical skills is actually going to be better fine-tuned. So you're not losing any of your skills. In fact, you are putting all of your years of experience, you are putting it into use every day in CDI. So CDI gives you that advantage. And the other thing I say to people is that if you are the kind of person where when you walk on the floor, you always want to document events properly, then CDI is for you, because you're going to enjoy what you're doing. You're going to enjoy reading through doctors and nurses' notes and being able to identify clinical indicators and being able to piece these indicators together and use it to get appropriate diagnosis. Yemi, I don't know if you want to add to what I've just said with regards to the question.
Hello, Yemi, do you want to add something to what
You said?
Yeah, you can unmute yourself, please. You're muted.
I keep muting myself. So another good thing, like Dr. Wale mentioned about CDI, is the fact that sometimes when we've worked in bedside for a while, we get fatigued. It could be, stressful, because I've worked in bedside for a long time. I know how it is, how demanding it is. And if you are looking to step away from that stress, and still be in that nursing profession and not leave something that you love passionately, CDI is another way to do it without losing your value, without losing your knowledge, and at the same time benefiting from working from home, from having a balanced family life, which comes from remote jobs.
Wow. Wow. This is mind-blowing. I'm beginning to understand that, maybe I could have gone into CDI before because it will help me in my let's say being able to diagnose, somehow like that, because I think with CDI, it deals more with you, looking into charts and reviewing everything that has happened. So every day of my life, if I'm a CDI specialist now, I'm always reading how doctors interpret symptoms and how they treat some conditions. And I think it will make me a better person as a person, though. I don't know if for another person, because I'm reading how Dr. A managed this condition, then I'll read how Dr. B managed the condition, then I'll read. So you guys read all the charts. You're able to go into charts and read them and make your inferences from those charts. Is that what the job is all about?
Yes, and there are criteria.
Sorry about that.
As for each diagnosis that is accepted, it's services.
Okay, so there are criteria for each. So you guys have like a guideline or guidepost in all the things.
things to follow, and they kind of help to make the job easy. There are so many things that are that's there to support, new nurses that are coming into the field. Yes.
Wow. Okay. Yemi and Dr. Oluwole, it's like you guys are going to train me in this. I'm beginning to be more interested in this career, honestly. I'm beginning to be more interested in it. Okay, so my number 4 question, and Yemi, if you don't mind jumping in. So with the rise of remote work and work from home opportunities because after COVID, a lot of people disappeared from the healthcare system. Like, the healthcare in the US is currently short-staffed, not because of any other thing than because a lot of people with COVID, it opened their eyes. You know what? I can do something else. I can't be in the hospital. I don't want someone told me I don't want the next pandemic to meet me at the bedside because I don't know if I'm going to survive it. That's what the person told me. He said, the next pandemic, nope, I'm not doing it. So I'm out. I want to go and look for what to do. So, but you said this job is actually a job that you do from home. So even if there is COVID, I cannot get it because I work from home. I'm not in direct contact with the patient. So with the rise of remote work and work from home opportunities, can individual in the clinical documentation improvement field take advantage of this trend? Are there remote job opportunities available for clinical documentation practitioners?
Yeah, there are very many, I mean, lots of remote opportunities. Even before COVID, some clinical documentation specialists were already working from home before the advent of COVID. But there were still a lot more CDSs that worked in office. But with COVID, it made more institutions transition into the remote platform. And they realized that people are even more productive working from home compared to when they were in the office. With the office, there are distractions. Your colleague is there, you chat with them, you smile, you show them pictures. You know how they do here in the US. Mm-hmm. So it distracts from work. But when you're working from home, there is this thing that says, oh, I need to show that I'm actually working. So you want to meet daily targets and all of that. So that has been proven to demonstrate that it actually increased productivity. And then beyond, with the advent of COVID and remote working, if you noticed, some people that worked in the IT position, some of them have been asked to come back to office, but it's not really like that for CDI. Now, I'm not saying that there are no office jobs for CDI. They are available. They are hybrid positions. There are positions where they require you to come into the office twice a week and stay home 3 days a week, but there are still a lot of remote opportunities, and a lot of those remote opportunities want to stay remote. They are not even looking to go back to the office.
I won't go back to the office if I were them. All right, so now there's another part to this, because the way I'm looking at it is there's a hospital in Houston. It's called Houston Methodist Hospital. So recently they introduced virtual nursing. So what they do is if a patient is about to be discharged from the hospital, instead of having one of the nurses on the floor discharge the patient, they have nurses that are back home working remotely. They will set up a video discharge instruction meeting with the patient. So the nurse from home will be the one talking to the patient, giving the patient all the discharge instructions. And I say this is smart because with that, you have already relieved a lot of people who may have who is supposed to, still be standing in front of the patient and giving the patient all those information. So remote job is actually a good way. In fact, if you have not gained that IT skills, like some skills with computer, start doing it now if you have not come to the US yet, because that skill can set you up for you to be a millionaire in life. Because once you're able to get yourself acquainted with how you can work remotely, there's a lot of opportunities that you can tap from. So this is for you. I'm not presenting, but I'm just saying this just for saying sake, okay? So the next question that I have, trust me, I'm going to cover a lot of area because I'm interested too. That's why I went this far. So what skills or qualifications are typically required to succeed in clinical documentation improvement role? Are there specific certifications or credentials that the employers value? I'll be pointing these questions to Dr. Oluwole.
All right, thank you. What skills, qualifications are required? I would say that the fact that you're a registered nurse already qualifies you to work as a CDI specialist. And usually, if you're a nurse with years of experience, is an advantage as well. But beyond that, because again, now you're looking at some ICD-10 terminologies, you're looking at some terminologies that the uh, the coders use when they're doing final billing for the patient. So in CDI, they usually want somebody who understands this thing. And the best way that you can show that you understand some of these new terms is to actually get certified. And one of the certifications that you can get readily is the CDIP. CDIP stands for Clinical Documentation Improvement Practitioner. And another one is CCDS. But the thing with CCDS is that you need to have worked as a CDS for about 2 years to get it. So the one that is easy for you to get right now is the CDIP certification. Now, CDIP is also a little bit niche because when you're preparing for the certification, there are some books that you have to read. There are so many things that you have to get from different places. Because I remember when I got into the field, I had to be searching the internet to get one material here or there, get another material in another place. But one of the things we've done is to actually pull all of these things together and design a course that makes it easy for you to just have everything at your fingertips. So as a nurse, you can actually get into the CDI field, and to make it better, you pick up the CDIP certification, then you can start applying for clinical documentation roles.
Awesome. Awesome. Thank you so much. I'm just in my fifth question, and a lot of interest are there in the comment section. There are very useful questions that has been pumping in there. Trust me, I'm going to read all your questions with the help of those that we've invited. By the grace of our guests, we'll be able to attend to all the questions that we have here. But we have to go through my own question first. I invited them, so I have to make sure they answer my question. All right, guys. So now my question 6 is, and I would like you, Doc, to take this one too. So how does clinical documentation improvement contribute to overall quality of patient care? Can you provide some examples of how accurate and thorough documentation can positively impact patient outcome?
Okay. I think in the course of this discussion, I know Yemi mentioned the scenario of a patient that came in with altered mental status and how the CDI was able to link the altered mental status to the other infection diagnosis that the patient was being managed for. And by linking it together, they were able to get a diagnosis of metabolic encephalopathy. Now, that is going to improve the quality of care of this patient, and that is thanks to the clinical documentation specialist. Another common example that I like to give is a patient with hypoxia, for example. Let's say the patient came in with dyspnea, the patient has an oxygen saturation of 85% or even less than that, and the patient is probably on 6 liters of oxygen, but the doctor documents hypoxia. But you and I know that based on this criteria, the patient is leaning more towards a respiratory failure. But now, if the clinical documentation specialist is able to capture diagnosis of respiratory failure, one, he helps the patient's care because the doctor is more aware of the severity of the patient's condition by saying that, okay, this patient actually has respiratory failure as against hypoxia. Then, of course, it helps the hospital as well because they are documenting that the patient that they admitted is more severe. And of course, that makes sure that the appropriate reimbursement is captured as well. I think another example that I can give, I think I mentioned the one of sepsis earlier as well, where a documentation of UTI is what the patient is being managed for, but the CDI sees that the patient has other clinical indicators that is pointing towards sepsis, and they were able to capture that. Of course, the treatment that you give for a patient with UTI and the one that you give to a patient with sepsis, they are different. Because even your level of monitoring is different. So if you're able to capture the diagnosis of sepsis, the doctor is going to be more aware of the patient's condition. And so that's one of the other things that CDI does. So we impact patients' outcome by making sure that the severity, the accurate severity of the patient is properly documented. Then apart from the severity, we also make sure that any missing diagnosis is captured as soon as possible while the patient is on admission.
Awesome.
I think I've given about 3 examples now, but again, I'm going to throw this to my lady partner. Yemi, do you have any other example you just want to give just to make it 4?
You can unmute yourself.
You are muted again.
Yeah, I think you said it all. Basically, we point the doctor's attention to a more severe diagnosis, and that actually translates to the doctor making sure that the patient receives the care that corresponds to that severity of the severity of the condition. So there are several examples like that, like what Dr. Wally mentioned. But the major thing is that once we send a query out to the doctor, he looks at it, he agrees with that diagnosis, then he's going to make sure that he increases the level of care he's giving to that patient, making sure that because that's why it's important that clinical documentation specialists review while the patient is in the hospital. Imagine if the patient has been discharged and the patient did not even get that care while the patient was in the hospital, then that is a waste of resources, because that is losing out, that is not giving the best care possible. But if you're able to, the patient is here, that patient receives the level of treatment that the patient requires, and that patient is going to get well on time.
Awesome. Well, the way I see it is that, you guys, read this chart over and over, and then you are so used to the trend of events. So someone was admitted today with hypoxia, and this was how it was managed, and the person went home, everything was okay. Another person was admitted by another doctor with hypoxia, and it was managed a different way, and they were suspecting all kind of stuff. With your experience of how the first one went, you can actually question some, things that the new doctor is doing. So I think is a very exciting, area of nursing that me myself would like to get into if I'm not doing what I'm doing currently. But what I'm doing currently is actually interesting. But I want to present this to my friends because I would like you guys to also be smiling from both sides of your mouth. Some people smile, but sometimes when it doesn't come from both sides of your mouth, it means something is there, like the smile is not complete. So, but I want you to smile from both sides of your mouth. Try this career that I'm presenting to you. Do not miss the opportunity. I'm saying this for people who are here in the US. This is a very good opportunity to get away from bedside. It's also a very good opportunity. I'm saying it, but I'm not saying it with both sides of my mouth. Like I said before, it's a good opportunity for you to pick a PRN opportunity, like a PRN job, and then merge it with this clinical documentation improvement as a full-time job. That would be like, mind-blowing. You do things and people will say, is it just nursing or there is something else? This is the something else. And this opportunity is an update. I'm giving it to you guys. I've done my own by giving it to you the way it came. All right, so the last question I'm going to take today, the last question is the question number 7. I just want to ask, are there any specific area within clinical documentation improvement that are currently in high demand? Which specialty healthcare settings are seeking professionals with CDI expertise?
Is that for me?
Yep, that is for you, Yemi. Maybe they say ladies first. This is ladies last too.
I think she's herself as well.
Okay, you wanna jump in and help us?
Do you want me to say so? Jump in just before she figures out that she's on mute. Yes. So one very common area that is in high demand in CDI is inpatient CDI. That is, any hospital that takes patients regularly, they want inpatient CDI, and we're seeing. In fact, all the big hospitals, all the tertiary hospitals, they all have CDI because they've discovered that CDI ensures that reimbursement is accurate and also ensures that you are accurately representing the severity of the patients there. Then apart from that, even hospitals that are located in remote settings are beginning to employ the services of CDI. Because no matter how small your facility is, if you have somebody who is looking through documentation and ensuring accuracy of all diagnoses, it goes a long way in making sure that you are capturing every diagnosis of the patients that you have. Now, apart from inpatient CDI, some areas are also beginning to evolve as well. I know about outpatient CDI. That's like, outpatient clinics. Now they are beginning to employ the services of clinical documentation specialists as well, because they can see the importance of having a CDI look over the provider's documentation. Then even in other specialty like in obs and gynae, I have a friend who is doing pediatric CDI. Then I know somebody else who is in surgical CDI, where they are only focused on surgical patients and making sure that the diagnosis are accurately captured in surgical patients. So that is how broad CDI is. In fact, I know somebody else who works in neurosurgery CDI, just neurosurgery. And they are making sure that every diagnosis in that neurosurgery clinic is perfectly captured. But the most common one is inpatient CDI. And usually for many of these people, inpatient CDI gets you into the field, and then you can decide to subspecialize afterwards.
Mm-hmm. That's good. Now, just to ask a little more follow-up question to that. Um, I know you've trained a lot of people in this field before. I know that people have gone through you, and I just want to know, how successful are those people who have done this training with you?
Okay, that's for me.
Mm-hmm.
Yes, I think I've lost track of the number of people who have gone through me now, but one thing I vividly remember is that every person that has gone through this course has had success in the CDIP examination. And not just in the CDIP examination, but these people have gone on to get interviews and have offers, not offer one offer, but more than one offer in the CDI role. So that is one thing we are very proud of, that we get you to the point of getting your certification. And not just that, we also get you desired interviews, and we make sure that you land a role in the CDI field.
Yeah. Okay,
So we
so
are
it
willing
looks
to
like you
train people.
support your students after training. Like after they graduate, they can still like relate some of their concerns to you, and you're able to help
That's
support
correct.
them.
That is one thing that we've been doing. So we don't just get you to pass the exam. After passing the exam, we continue to support. We help with resume preparation. We make sure we revamp the resume. We also help with interview prep as well. So we don't just leave our students out to dry. We make sure that they are well prepared for their interviews. And even after landing their desired CDI job, we're still available for students to reach out. When they run into difficult situations, they can still reach out to us, and we help them out as well.
Wow, that's full package. That is what I call full package, honestly. You know, you do a training and then they help you to revamp your CV and help you to position you to get a job. Then you get a job and they still support you to. I hope you guys should tell those students that they should also support others, so that I guess the work is kind of balanced, because if everybody is coming to you, by the time that all the people that are listening to us, for instance, is coming to you, maybe that will be your full-time job. So I know that sometime there will be that provision to make them also return the favor, like to pay it forward. Whatever that has been done to you, you pay it forward to another person. That way, it becomes. But that's mind blowing. Honestly, this is an opportunity, this kind of opportunity, I don't miss out on it. And I trust me, I might be contacting you for after now for me to do my own training. Honestly, as I joke apart, this is just me. This is a very good opportunity that I'm bringing to you guys. Okay, so I have some questions on the comment section. I would just like to read some of them out. I mean all of them, because I had to pause my own question to be able to take this question. I feel like those that asked it are very passionate about it, and I don't want them to miss out on the answer. Okay, so the first question is from Ade. Ade is asking, do you need to start from medical billing or coding before becoming a CDI practitioner? Yemi, do you want to answer that question?
Yes, I like to answer that question. No, you don't have to. You basically just need to be a registered nurse or a medical graduate. So those are the two major criteria. But of course, people with coding and billing experience could also get in, but they will need more certification and experience and some courses to be able to come into CDI. So basically, you don't have to if you are a registered nurse or a medical graduate.
Awesome. Awesome. So your nursing license is very, very important. That thing is very powerful because it gives you access to lots and lots of opportunities like this one. Okay. So if you have not written your NCLEX, whether you're doing for Canada or you're processing for US, please kindly get it done. Okay. I know you can do it. I have so much confidence in you. Just get it done and then be open to some of these opportunities. If you have questions, please go to the comment section and then ask your question. When I get to you, I will read it out. I have another question. I think this question I would direct it to Dr. Wole because the person that asked it passionately. So does it mean that someone that is not in health-related specialty cannot work as a CDI practitioner, assuming the person has been working as a care support worker in UK? All right.
Okay, so there's a short answer and there's a longer answer to this. The short one is no, but the long answer is if you are passionate about CDI, there is a pathway to get it there. Now, for somebody who is not exactly in the nursing or medical field, the pathway would be to first get into coding. And then because to get into coding, you don't need anything. You are qualified right now to get into coding. And then once you are in coding, you need to start taking some clinical courses. Like within the coding field itself, medical coding, there are some courses like anatomy, physiology, and not too difficult courses that you can start taking that will then qualify you to be able to take the CDIP examination. It's a longer path, but if you are motivated, you can actually get there.
Awesome, awesome. Motivation is the main thing. I think my secondary school, one of our motto is determination is success. So once you're determined, you would eventually be successful in it. Okay, so I have another question. Someone is asking, what is the duration of the certificate course? How long do you take to get, like a novice like me, how long do you think I can start running on my leg on a CDI pathway?
So the plan right now is to it's on the 5 weeks course. So we would like that students probably book their exam for the 4th week. So when they are done with the exam, because we put together material, if you have to do that on your own, like do on your own, it's not something that you can achieve in 4 weeks. You have to be fully determined because the materials are quite, they're quite voluminous. But we'll try to put them together to pick out the things that are important for you to be able to pass the exam in 4 weeks. Then after that, the last 1 week is basically we're going to be talking about how to do a good CV, that is the CV revamping aspect, and things that we need to know for interviews. Yeah.
Wow.
And then we were also thinking about the possibility of after graduation, we're going to create like a WhatsApp platform for our graduates so that when they get jobs in the future and they have questions, they can, ask questions on that group. And with time too, they're self-sustaining. They can also help the new people coming into the field. So it's just what we're trying to build a community as well.
Good, good. I would like to be in that community as well too, because it's a community that I believe that will support a lot of the spouses of registered nurses. So let's go back to where we started from. Lots of questions about husbands, what they are going to do when they come to the US. Here is an answer. Okay, if that person is not in the medical field, the person can take some courses to get in position to be able to do CDI. If the person is already in the medical field, it's a one-directional movement into CDI. And once you do this 5 weeks, just 5 weeks certificate course. What I'm hearing from them is that you will be told to schedule your exam, the certification exam, on the first week of your training. Okay, so that way on the 4th week, they know that all the people who enrolled for that course is testing on the 4th week. So at that 4th week, before that 4th week, you'll be prepared to take the test. And once you take the test and pass, they will also support you to make sure that your CVs are good, your resumes look nice, you're able to attract a job. And then from there, they will also make sure that when you get a job, that you're successful on the job. That's what I'm hearing. So this is one of the, solutions that I'm bringing to you guys. For those that their spouses are not working currently in the US, you can take advantage of this. And also for the nurses that are working and their spouses are not working, this is a very good opportunity for your spouse to work from home. That way, picking up the keys from school bus, from school or from anywhere, that one is because someone is always at home that will take care of home affairs, okay? While you go to work, or even if you went to work and you're tired, at least your husband is back home. The importance of working from home is that you don't have to always be in front of your computer and take excuses if you want to step out. You can actually go and drink water and come back without nobody knowing that you stepped out from your computer. Okay, so that's it. That's it. It's a very good opportunity, and I want everybody to take part of this opportunity. So someone is asking, Chisom is asking, do you have to currently be in the US to join the training? Do you have to be in the US to join this training? Dr. Wole, can you answer that question for me, please?
No, I think if there's anybody who has plans to move to the US, it's like you putting yourself in a good position. Why wait until you get to the US before you start working on getting your certification? So no, you don't have to be in the US to join the training. You can start working towards what you would do when you get into the US by joining the training already, getting your certification, and then when you get to the US, you're ready to go. Now, let me even say that there are some CDI positions that are available for people who work internationally. I know of some hospitals that use international doctors and nurses. So if you get the CDI certification and you put in the work to look for such roles, you can actually even start working as a CDI before you relocate.
Wow. Wow, that's another part of it. I never looked at it this way, honestly. Trust me, I never looked at it that you can actually start working in this field before you even relocate to the US, and it's something that you can take advantage of too while waiting for retrogression or your visa processing to be completed. All right, that's a good point. Thank you, Doc, for bringing this up. All right, so I hope your question is answered, Chisom Duru. Let me go a little bit forward again with the questions. So the next question is, please, from Nigeria, can one do it before in migration, and can the work be done from Nigeria? That's just what he answered. He said yes, you can seek, once you finish the program, you can seek job in this area where the hospitals need CDI from international people. You can seek that job and start working from back home even before you come to the US, because you have the NCLEX registration, you have the NCLEX pass, so you have your license in the US, and then you have done your certification course and you're good to go. As far as I'm concerned, I think you should be good to go to work internationally. So can we run it from Nigeria? The answer is yes. So what's the remuneration like? So somebody is asking, what is the remuneration like? So can you give us an instance of how much that a CDI practitioner takes?
Hello, this is Yemi.
Okay, Yemi.
Yeah. Say that the answer to that is that it varies. Like Dr. Wale mentioned earlier, Google is our friend. We can go online, we can check on LinkedIn, we can check different platforms to see what the current salary is like. But for me, I would like to say that it varies a whole lot based on your years of or medical graduate based on how many years you've been in CDI itself, and also the location that you are getting that job in, not just where you are living, but where you are getting that job in. For instance, a place like New York will pay more than other places, like maybe let's say Texas, and a place like California will pay more than places like Arkansas. So there are different like you could make as much as 160, 170K per year, even up to 250K, depending on how much there is no limit to how much you can earn. But I would say that the least I've seen in the field is about $80,000 a year. We can go as high as possible.
Wow, thank you so much. I just jumped on Indeed right now. I'm trying to see if I find some things to show our audience. So CDI jobs on Indeed. So let's see how much that this job is paying. Are you guys seeing my screen?
Yes.
Okay.
Yes.
All right. So I have one. There are so many openings for CDI. Oh, this is not CDI. Is it CDI? No, it's
No,
not.
it's not.
Let me put the CDI specialist remote jobs search. All right. So you have this one for like $65,000 to $75,000 a year.
That's okay.
You said that's small.
That is not CDI.
Oh, this is not CDI. Oh,
I
that's
think it was search stuff
it's
again.
clinical.
Yeah, maybe you should spell it out, like clinical
Okay.
documentation specialist.
Okay, let me do that. Okay, let's see if this is it. Is this it? Clinical documentation? Okay, let's look for how much we have. This company is 70,000 to 80,000 a year, like Yemi said, says 70,000 to 80,000 a year. And this is saying coding. This is just for application coding. Go ahead, Yemi.
Said that just for coding. Like I said, can you check maybe a place like California, New York, see what they are doing there?
Yeah, because it's remote, so they can work from anywhere. Let's see. California.
And we can also try LinkedIn too.
All right. All right, showing us California rates now. Okay, this is $68 per hour as max. This is $40 per hour. This is 19. This is not. This is not. Okay, so let's see which one is clinical documentation.
You passed one now.
Okay.
You passed.
This
up,
is it.
Up. Yes, this one.
This is $87 an hour. That's like being paid $87,000 an hour, 1 hour for 87,000. Okay, wait, let's see. There's another one. This is 84,000 to 100. No, this is not it. Okay, so this is clinical documentation manager for 145 to $210,000 a year. So if you divide that, it should be averaging like $18,000 a month or more. That's how much this person gets paid. Then this is not it. This is not it. This is not it. There's a lot. You can actually refer to Indeed or LinkedIn for more opportunities in clinical documentation improvement practitioner. There's a lots and lots of job here. Okay.
Have the word remote, it's going to filter out a lot of jobs. So
Right.
there are positions that are out there, but they didn't put actually remote.
Yeah, actually, I've actually seen lots and lots of these kind of positions, and they are offering like $120 an hour. There's a lot that I have seen on this clinical documentation remuneration. I just wanted to show you guys so you can see it for yourself. It's not like the jobs are not there. The jobs are there. You can take advantage of it. Okay. So let me start the question from where we stopped. This is, okay, then the next question says, please, the cost implication to super nurse boss D. Okay, so she's asking, what's the cost implication for the training? How much do you charge for the training?
So the cost implication for the training is 1,000 naira, $1,000 for the period program. But because this is we're currently doing a 50% off for this batch, so it's going to be $500 for this batch right now.
Wow. Wow. That's like 50% discount for everyone who will be in the program. Wow. That's a lot of discount right there. So let's see more on this. I hope this recording will be shared. Yes, we will be able to share the recording after now. All right, so Stella, your video is on. Somebody is telling Stella, please, your video is on. Can you remove your video? Maybe it's disturbing some people. Then this question is from Olalere Olajide. Thanks for information. Is USMLE required for foreign medical graduates, MBBS, to enroll in clinical documentation? So this person is asking, do you have to have started the process or passed your steps before you can be, in this field?
Let me take that question. So not really because having your doctor's certificate from Nigeria is enough for you to work as a clinical documentation specialist. Though I must also say that if you have your MD license, that's your MBBS, plus the certification, it improves your chances. Then if you've taken steps in the USMLE, like if you've written step 1 and step 2, enough that you get what they call the ECFMG certification, it's also better. It also improves your chances, but it is not necessary. There are two different parts. So the fact that you already have your doctor's certificate from Nigeria and then coupled with getting the CDIP certification is enough for you to work in the field.
Awesome. So thank you so much. So you can work, Lajide, you can actually work in this field without USMLE, from what I gathered from Dr. Oluwole. So also someone is asking how much is the training? The training is $500 for 5 weeks of training with I won't be able to say how much support you'll be getting from them after the training, but that's the 5 weeks training is $500. All right. So the training is starting on the 26th of November, right?
Yes.
Yep. And then we are timely on this program. So if you want to take advantage of that cohort and join the class, then the details of the payment will be shared later on. All right. So said another question is, I and my husband are interested. We are currently in the UK. So Chisom, you can reach out to me after this program. Then I would direct you to how you can make payments from UK to them, and then you can start the program. All right. So someone also asked, upon certification, can someone be working as a theater nurse in US full-time and also as a CDI practitioner part-time? I think this question will go to Yemi because Yemi is a theater nurse too. So you can relate to the question, right? Okay.
Yeah. And well, the thing is that most CDI positions are usually Mondays to Fridays, and getting into the field, they are part-time positions actually. But when you're getting to the field newly, I would not recommend starting with a part-time because you have a lot to learn. You need to understand the ropes of the job. But what I can recommend is the fact that you could do CDI full-time, Mondays to Friday, 8 hours, which is pretty flexible. Some people start work as early as 8 a.m. and 6 a.m. and are done by 2 p.m. It's pretty flexible. And then you can do probably OR nursing part-time or PRN. And I have found out that PRN position pays way better than full-time position. So you can get your benefit in your CDI job, the health insurance and all those good benefits, and then pick up a PRN positions that pays you a lot more than a full-time or job will give you on probably weekends or evenings or stuff like that. Yes. But
wait,
that way around
did you say you have health insurance and dental and everything from your job as a remote from your home?
Yes, definitely. The full benefits.
Really? Oh
Oh,
my
Yeah.
God. So you get to have your health insurance from your job.
Yes. The and
Lord
for
have
one.
mercy. I didn't know that remote jobs offer that health insurance. It's just like working from your home and you're being taken care of.
exactly.
Wow, this is amazing. Honestly, I can't overemphasize how good this offer is. It's such a juicy offer. All right. So for spouse, Stella is also asking for spouse who are not in medical field, what course can they do to qualify them for CDIP while retrogression lasts?
Well, in the meantime, just like Dr. Wally mentioned earlier, one thing is probably if you're not in the medical field, I really cannot say, like, give you the details of how you can go from medical coding into CDI, but I do know that it's a bit longer process because there's a lot to learn. It's not like a soft work. There's really a lot to learn in the medical field. So, but I do know that if you do start working in medical coding and billing, if you learn coding and billing, there are a lot of online, trainings for medical coding and billing. If you register for that, and then when you are done with that, with coding but when you do coding for a while, you have some experience. And I think there are some certification like RHIT that you could do. So most time when you see people that are clinical documentation specialists and they are not nurses or foreign medical doctors or medical doctors, they are usually RHIT. You see that RHIT in front of their name. Usually they start from the coding pathway.
Wow. Okay, Stella, I hope that answered your question. I can relate to the question that you asked, and I know a lot of people will have the same question as well. Like, your husband is not in the medical field, how can they benefit from it? It can be done, but it's a lot longer. It's not like a 5 weeks crash course that that they are presenting to you. It takes a longer time to get you through and be able to. But why retrogression lasts, like you said, this is something that you might likely take advantage of. If you need more guidance or assistance, we can talk after the program, and then we can know how to link you up with the presenters, my guests, and then they'll be able to assist you with some other information on how to get into this field. All right. All right, so let's go a little bit further. I have another question from Ogechi. Ogechi say, how much is the training and documentation? Okay, so we've answered that question repeatedly. The training is for $500, and then the certification is what I think I don't have answers to that. So how much do they pay for them to register for the certification?
I think it's I can't say the exact price right now, but I think it's not up to
$329.
How
how
much?
much is
$329 for the certification.
$29 for the
The
registration.
IP certification itself, yes, the exam.
Wow. Okay, so once you're into this program, I think you should make provision for around $800, $829, because 500 will go to the training, and then the 329 for the registration, and then you should be good to go. All right, that's all the cost. Fumilayo Owolabi say, thank you, sir and ma, for the information. Please, how often does the training come up? So how often do you guys have this training? Is it a monthly training, or it's not monthly because it's 5 weeks, right? So it's gonna overlap.
after
So
every
every
5 weeks?
5 weeks.
Yes, it's
Yes.
every 5 weeks. We usually try to build up for the next set before we are done with uh for example, we have one starting on the 26th. So before we're done with that one, we're already adding people to the next set. So usually we don't stop. So when that 26th of November set is done, we're starting another one like that, non-stop.
Awesome. Thank you so much for giving answers to that. So the next question is this is so much money for us. Well, this is not actually this is an opportunity that we are bringing for you guys. I'm not saying that you have the money, but this is something that if you have the means to do, I think it's a very good opportunity. All right. So let me see. That's so much money. Then what again? So how much do you consider in Naira? How much do you consider in Naira? 500K or less? I don't understand. Olajide, can you unmute yourself and ask this question so we can understand what you mean by consider?
Yeah, thank you very much for the opportunity. When you said $500, I was thinking that the exchange rate in Nigeria now is 1,100. And so I was thinking probably official rates, exchange rate is 770 naira. So if you want us in pay in naira to use official rate, then it will just be 770 naira multiplied by 500, and we'll pay into your naira account if you want to consider. However, if you want us to use the black market rate, then we have to pay maybe 500K thereabouts.
Okay, I get where you're going. So, do you know what will happen, Olajide, is we are going to have to, I don't know, what do you guys think? Do you have any answer to his question, or do you want to, respond to him after now and give him a rate to pay with?
Well, I don't know. Is it possible to get that rate in the bank? That's the thing. Like, if you go into the bank and you give them, are we able to get that? That's the challenge.
Definitely not.
Exactly.
Not.
So that's the challenge. It has to.
So we have to pay into your domiciliary account.
Yes, domiciliary. But it has to be black market so that when we change it, it's the equal of $500. Because I'm sure we can't get the $700.
No.
The 700 naira.
Okay, what's the method of payment?
When you are ready.
For us in Nigeria.
Oh yeah, so they said that they're gonna send you like the payment details so we can go. So I'm gonna drop their email address. So once you email them and request payment details, it will be sent to you, and then you can go and make payment. And once you make payment, you can send the evidence of payment to this email so that they can confirm the payment and add you to the next cohort. Novel training services.com. Okay. All right. So the email address is right there, admin@noveltrainingservices.com. Once you email them, they'll be able to respond to you back. They will, send you all the things you need for you to be able to make payments in Naira, and then you'll be added to the class. But trust me, a lot of people have already registered for this class and they are gearing up for it. All right. So
thank you.
Okay, thank you, Olajide. So let me see where I stopped in the question. I think I've taken almost all the question. Okay. So this is wow, but the charges. Can you consider reducing the price? I'm interested. I think they said they reduced the price already. I don't know. Can you guys attend to the question so that it won't be like Doc.
Regards to the price, what I would say is this. I understand that it looks as if it's it's a lot, but again, if you go online and you look at available clinical documentation training courses, you would see courses in the range of 2,500, and you will not even have in-person trainers. They will just hand over materials to you and say, go and read, that is it. But what we are doing, I think it's beyond the money. It's all about taking the time out to actually train people, to train nurses, to train Nigerians, to train Africans, to train a lot of nurses in this road where they can use their clinical skills to work remotely, to get out of bedside practice. And it's the value that we are offering and the fact that we're also giving you support after you get the certification, the fact that we are helping with interview preparation and helping you land the job and even holding your hands after you get the job, you really cannot put value on it. And even at the 1,000 original price, it is a steal. That's the way I'll put it. It is a steal. You can go online and check what they are charging everywhere else. It is a steal at this price.
Wow. Wow. Okay. they said that it won't be possible for them to do a reduction in the price, but they will. They said that they've already given a discount on that. Sorry, I was a bit distracted. All right, so they said they've already given a discount on the price. So I have another question that says, are nursing assistants considered, or do they have to go through medical coding route?
Again, same response. You will have to go through the medical coding route. But again, don't give up, because I have worked with and I know a lot of medical coders that are in CDI today. So if you are motivated enough, you can still get there. But the first route is to get into medical coding. And then once you're in medical coding, you can then chart your path into clinical documentation.
All right. Thank you so much. Now I have a question from Abiodun Okanlewon. Okanlewon is asking, thank you for the enlightenment. Which book do you recommend for one to read ahead of this course? So which book do you want him to read ahead of the course?
Yeah, I mean, do you want to take that, or do you want me to take that as well?
Is that there are books that you could, buy, read, but we thought about reducing the cost for people and limiting the time that they are going to be using to read. So we kind of made everything into our program such that even though you are studying, you are reading, it doesn't feel voluminous. Imagine some of us, I would like to relate with people that are preparing for NCLEX. See how much you have to read for NCLEX. So imagine somebody making it simpler, like you don't have to read all those big sounders. You don't have to go through those big tests where maybe only 25% or 30% of them would actually come in the examination. You can actually meet in the examination. So what we are doing is to try to, because these books are really expensive, they are scarce. You can't see the physical copy. Even if you go on Amazon, you can't get them. They'll keep telling you it's coming and you won't get it. So the only alternative is probably buying an e-copy of some of the books, and they are really, really pricey. I think one of them is over $100, is it? I'm not sure exactly.
One that is over $100. There's another one that is about $55, and then there's another one that is like $40. By the time you start adding it up, I remember when I got into the field, I must have spent over $350, well over $350 getting the books. And that's before inflation came into the country. So I don't know what the cost of those books will be right now. So it's a lot of books, and it's piecemeal. There are some books that you will buy that the only information you need from that book might just be like 15 pages out of over 200 pages. Another book, you might only need about 30 pages, and the book is more than 150 pages long. So what we've done is to identify just the important points from all of these books, put it together, and I'll take it in a lecture series.
Wow. Okay, thank you so much. So if you want to read a book, there are books that they can recommend, but it's kind of almost pointless, going to those books since they have already known those high yield topics that you need to, focus on in this exam, because they come in contact with people who do this exam every time. And when they finish the exam, they said they do a recall with them and they'll be able to know, like, guide on what kind of things to expect. So even though they've written for a very long time, they still stay in touch because of the people that go through them and write the exam. Yemi, you want to say something?
Yes, another thing that kind of stimulated us to start this is because, when I found CDI, I loved it. I became so passionate about it. And when I talk to people about it, they just want to do it. Like, there's no way you hear about what we do that it does not interest you. I might not be able to pass on the passion today because I'm trying to be a little bit calm, or sometimes moment I'm talking about it, it's something I love so much. And I realize a lot of people want to get into it, but the challenge we see is that they go in, they write this exam, they fail. And for me, it's very disappointing. So we started talking to people, trying to see what we could do. And then over time, we see better results, realize that, okay, maybe focusing on this area is better than that. And then we've, like Dr. Wallace said, we've worked with so many people, and realize that if you are left to go and read materials and go into the exam is more of application rather than the material that you have written. So if you read the material and you don't understand how to apply it, you might not be able to pass that exam. So that is a challenge in it. People are interested in it, they go in, they get the materials, they read, but they are not successful in the examination. So this platform is to at least help people. Like, the thing is that one thing I can tell you is that we're going to try to help people to pass the certification. We cannot force people to read, but we're going to give you everything that we think that you need. And if you take advantage of it, we can guarantee that you go in and you will pass the exam.
Awesome, awesome. That's all the guarantee I need. I need to pass the exam because I know with what I'm seeing online, finding a job won't be a problem. And then, the job I will find is very rewarding, and I have to do the job from the comfort of my home. I can be in bed, support myself with a bunch of pillows, and be on my computer and be working. So I like that kind of soft lives. So thank you so much for coming to the program and all the questions, answering all the questions. We still have some more questions and I just want to take them. So somebody is asking, can we pay in Naira? That's something they said. Go to the email, send them an email, and they'll be able to send you the Naira account details to pay into. Okay. Then the email is right there, admin@noveltrainingservices.com. So someone is saying, please, can this be used in Canada too? So can you use clinical documentation improvement in Canada? Of course, they've said something about international remote jobs. You understand? So you can take advantage of that while in Canada, but I'll let them respond to that question.
Yes, for me, I know Dr. Wally mentioned about the prospect of international workers, which is very true. But most times when international CDI specialists are working with an hospital here in the US, they have like a body that is recruiting them from the United States to go and work with the hospital. So as much as it's something that is possible working in Canada, not like you're going to use it to work in Canada, but work here in the US. But I do believe that there are similar professions in Canada. But the challenge in Canada is that it's just like UK, where most of the healthcare is public, is the government that is taking care of it. So they don't need as much CDS, especially like they would in the US, because US is privatized. Although they are government hospitals, but they are very, very, very limited. So it's possible to get a remote job from Canada, like I said, but it's not as easy as it would be if you were in the United States.
Okay.
So it's possible, but it's just better when you're here in the US, or you're planning to come to the US.
So it's like saying yes, but the best is being here. But you
Yes.
can still work CDI from Canada, but the best way to work CDI is when you're here because you have more opportunities in the profession. All right. I have a Fumilayo. Fumilayo say, please, how do we know when there will be this type of discount again for those of us that are here to write NCLEX? So are you guys promising us, please promise my students that you will give them discount at least when they are ready?
We will look into it.
Okay. All right. So once they do another, I'll make sure I keep, sharing your publications, your flyer. So I will share it in all our platforms. If you see it and you look at it and you want to go ahead with it, then they would discuss discounts. Okay. All right. I hope that answered your question, Fumilayo. And then I have Eniliko. Eniliko, I think I missed a lot. Just join. I will be sharing the recording later on, okay? Chisomduru asked again. He said, you said earlier that you can do this job full-time and then get per diem job. Most of us coming to the US will come with sponsor. Okay. Now I see where you're going. Will come with sponsorship for about 3 years. How can we still do our full-time job and CDI job considering the above? Okay.
Well, that question, that's a very important question. Like I said, it's all about determination. There are people doing 2 80 hours job. It's all about determination, the strength that you have. But of course, like I said, there are PRN positions, there are part-time CDI positions. It's just that most times they want a lot of experience. But in your case, it depends on how passionate you are about it, how much time you have on your hands. If I were in your position, I will come into the US, probably do the with my contract, have some experience while I am there. Another way that would get, because the thing is, another advantage in this field is that they do like experience. They like, number one, they like US experience. They like you knowing things about CDI. You could probably in your hospital, your own hospital, if they have CDI there, it's something that you could probably shadow or volunteer there. And if before you know it, maybe your company might be able to switch you to their CDI department. Nothing is impossible. I've seen people switch from maybe one unit to another unit while they're on contract. I don't know if decency can
yeah. So that is actually true. I've seen people who are on contract, and while on contract, when they indicate interest in any area, that becomes where the hospital will channel their energy to. Most of your facilities that you may be posted to, like most agencies, they use remote facilities. There may not be people who have a well-developed structure for CDI. You can be one of those persons that they can send there. They will maintain your contract. They keep on paying you, or even bump up your pay, and then have you in that department work. Is a very nice way to grow in the profession, because you're charting a long pathway for yourself in the profession. Okay, so what you said is exact. I don't have anything to add. You just said it. You can be there. Once you indicate interest, they can push you to that department, and then you can now use that as your full-time job, and now have to get a PRN in your area if you still want to maintain your skills, maybe in med-surg or OR. All right. So for those of us in Nigeria, can we start working after certification from Nigeria, considering that I won't be able to do it full time? I think that's the question I just read now, to fulfill our contract. Yeah. So so the answer is you can do that. You can work from Nigeria if you get a job that is remote and open to international applicants, then you can do that. Then also you can when you come here, you can indicate interest in that area, and then you might be lucky that your hospital can push you to that area. Okay, thank you very much. This is coming from Oge Jen. Say thank you for this enlightenment. Thanks, Decency, for the opportunity. The time frame for this is short, though. When next is the program coming up? So it's supposed to be every 5 weeks, okay? So if you count 5 weeks from 25th of November, that's when next you will get another opportunity to join the program. All right. So is the exam online for us outside the US? Very interesting question. How is the exam? Is it
Yeah,
online? Okay.
need to go into centers and write the exam. But the beautiful thing about it is that there are online exams that are proctored, which means that you write it in the comfort of your home, but there's somebody on the computer watching you, making sure that you comply by the rules of the examination. So that's the beauty of the exam, the fact that you can write it anywhere from your home.
Wow, that's a good point too. All right, so Fumilayo Owolabi is asking, please, can you drop your mail again? Okay, I'll be dropping it shortly. Yes, we need the email. I will drop the email again. All right, so Chisamduru said, thank you very much. I get it now. And then Ukamaka said, please, I can't hear. Please check your device and see if you turned on your microphone. All right, that's the end of the questions. I know that you guys, if you have any question that you want to ask, maybe you want to unmute your microphone and ask a question, this is the time to do that. You can actually ask your questions, or otherwise we'll just hear a final word from all of our guests, and then we would come to the end of the program. Do we have any questions? Okay. When a teacher teaches and there is no question, it means that the topic was taught very well. Everybody understood it. All right. So I've dropped the email. I hope everybody can see it. It's admin@noveltrainingservices.com. So you can reach out to to them, and then they will send you all the things you need to know about this program. But trust me, this is a program that I would not let it pass you by without me presenting it to you. All right, so we have different other programs like the IT programs with COIS. You remember when we did that? A lot of people took advantage of that. Trust me, all of them are enjoying the program. And this is one of that kind of program again that I'm bringing to you. And I know that once you get into it, you will be enjoying the program as well. Thank you so much for joining us. I just want to get some final last minute word from us, from our guests. So first of all, I'll ask ladies first. I've learned from my mistakes. So Yemi, can you give us a final word? What are you telling us? Everybody's fired up. People want to do the program. What do you want to tell us? You're muted.
So the first thing I want to say is to thank you all for giving us your time today, for listening to us. And yeah, I'm going to tell you that if you register and you join this class, you're not going to regret it. This promises to be entertaining and informative and educational. Yes, it's something to look forward to. Everybody that I've seen in this field, they don't have anything negative to say about it. They have loved it. They have loved it. Believe that they'll love it too.
Awesome. And both of you are part of the faculty in this program. So if they register, they will be seeing more of your faces, in the classes teaching them, right? Am I correct?
Yes, definitely.
Awesome. Okay, let's come to you, Doc. Give us your final words. We're so excited that you came to join us today.
Thank you so much. Thank you everyone for the opportunity again to be able to present CDS to this community. One thing I would say is that I have been privileged to help a lot of nurses and a lot of doctors get into this field. And I will also be blessed if you can give me the opportunity to add you to the CDS family, because that's something I've been doing. I've been able to walk so many people through that process. And if you give us a chance, I can promise you that you will not regret it.
I'm your number one registrant from this event today.
I need you to come and join as well. Because again, let me just add that until you experience it, the flexibility of remote work, you cannot put money on it. So please come and join that family. Please, you will not regret it.
Awesome. I know I can take your word to the bank and it won't get bounced. I can always trust you because you are a very nice person. Everybody that knows you, talks about you, said this guy is very straightforward. When he says something, he means it. So thank you very much for coming to our program today. We really appreciate both of you. Thank you for coming to join us. We are really excited that you guys gave us your time out of your busy schedule, and you were still able to find time to be with us today. We really appreciate that. And to our audience, please, even if this time around you're not prepared, put this in your agenda. Go and get your jotter, write it down. That sometime, somewhere in your future, you're going to be taking this program because it's something that would put you in the right path towards becoming financially independent, like financially free. You're free to make some financial decisions without being a burden to yourself or to your family. So this is one of the very good programs. Expect more. There is still more that I'm going to bring to you, but trust me, this one shouldn't pass you by because me too, I am getting into it. I would like to multitask at this point. I think I can do my job, my business, and still do this and gain from the two sides since I can do it from home. All right. So thank you very much for coming. I really appreciate you. And then I pray that when next you guys have something going on, maybe another program you're launching, that when I call you, you guys will be able to come and join me on this platform. We always do this every Friday. We bring information to people, and all my guests, all my audience are so excited that you guys came here today. So like we always do, my audience, please, can you go to the comment section and just appreciate our guests by just saying a simple thank you. Until I see you next week, from me, goodbye and God bless. Bye.